I am a paediatric orthopaedic surgeon.
I am a paediatric orthopaedic surgeon.
I am a paediatric orthopaedic surgeon.
I didn't always want to do paediatric orthopaedic surgery. Early on as a foundation doctor, I realised that I wanted to do orthopaedics. And later on in core training and then in my registrar training, I really fell in love with paediatric orthopaedic surgery.
I think the main attraction for me was that ability to see kids from a young age, follow them through their treatment as they grow and help them to do whatever they want to do.
Pediatric orthopedics is the one specialty where you can go from, surgically treating the hip, whether it's open reductions or osteotomies, to doing your knee arthroscopies, to foot and ankle reconstructive surgeries.
It is probably the best specialty in orthopaedics. It's the most diverse.
What do I like about it? Well, I like the patients. I love the people that I get to deal with. I love the variety of pathology, and I love the operations. There's a really broad spectrum of things we get to do.
Establishing relationships with families and children. I've been in post now for almost 3 years, and the kids that I started looking after with hip dysplasia, for example, when they were babies, are now running about as toddlers and giving high fives, and it's amazing.
I have to say I do also love that moment when you've draped and the lights are on and you're ready to sit down and start something, and everything else can go out your head and it's just the beginning of a procedure. That's also nice.
What I love is the practicality of making people better by using my hands and by operating.
I think about what changes have occurred since I started surgery. I think one of the big things is the shorter working hours today than when we first started.
I think we've seen a change also in training. We basically lived in the hospitals as juniors, and that's not the case now. We've had to evolve to try and train our next generation.
I've definitely seen a shift to more diversity in orthopaedics, and particularly in paediatric orthopaedic surgery, and hopefully more to come.
I think my favourite operation has to be lengthening.
I love the neurodisability work, I think, because you can be multi-region with it. You can be round the hip, the knee, the foot and ankle, the upper limb.
I think it's a toss-up between a complex hip reconstruction for late presentation DDH or a tibialis anterior tendon transfer.
I think the one that gives you most passion, most satisfaction is any operation on cerebral palsy children.
Good old supracondylar fracture.
So really, it's an endless variety of stimulating and challenging conditions. So every operation is different, and that's what I love about it.
I love taking something, planning on an X-ray, working out what's wrong and working out how I'm going to improve it.
I think working with people who have a passion for a subject guides you towards what you really like.
I think if you're the kind of person who likes a varied lifestyle and wants to have that spice of life of having variety, then pediatric orthopedics is definitely the specialty of your choice.
Come join us.